Hospice Caring is a nonprofit, community-based organization that provides social and emotional support to patients who have a life-limiting illness and to their families and those who are grieving. We have 4 major core program areas, one being our Volunteer Helping Hands program, which is our patient caregiving and companionship program. We also have our adult bereavement support services, children's bereavement support services, and community education. We have about 12 paid staff and almost 300 volunteers, so almost everything is done by volunteers.
As a caregiver, interacting directly with my patients, I see what kind of needs they need, and sometimes it's not just medication, but more importantly, it's the emotional needs. I just kind of expect it to be a 10-minute, quick introduction between me and my patient. That interaction became an hour-long conversation because she was going through so much. Towards the end of the hour-long conversation, you can definitely tell that she was feeling slightly better, and then that, just the first interaction just kind of made me feel proud as well.
So we learned about hospice caring through our 19-year-old son, Brendan. He was diagnosed with cancer as a sophomore in college, and he lived for 14 months. I started to volunteer with the Good Grief Clubs, and the age population I work with there is the high school students. Usually it's just one session where somebody ventures forth, and then it's sort of like the doors open, and other people walk through that door and begin to share, and then they start to develop their own sense of a little community in that room. The way I've been able to volunteer with hospice caring has helped keep Brendan present for me.
I volunteer with Hospice Caring as an adult bereavement support group facilitator. My first husband passed away when I was 32 years old. I knew very early on that once I got my legs under me, once I was on steady ground, I just had to become a facilitator. In the training for Hospice Caring adult bereavement facilitation, we talk about the 3 needs of the griever: to find the words, to say the words out loud, and to know that the words have been heard. I think that what we do in these groups is we give a safe space for people to do just that.